A functional civil registration and vital statistics (CRVS) system registers all births and deaths. Experts say it also issues certificates and compiles and disseminates vital statistics, including cause of death or causes, information and records of marriages and divorces. Now, the Nigeria Births and Deaths Registration Act 1992 makes the civil registration and vital statistics system compulsory nationally. However, documentation of Nigeria's demographic and health survey 2018 of the National Population Commission shows that only 43% of under 5 children in Nigeria are registered at birth and not more than 10% of deaths are registered. The story is the same in most African countries. Now, this year's Civil Registration and Vital Statistics Day has as theme Leadership for Essential Services, Building Resilient Civil Registration and Vital Statistics Systems in Africa. Now, the aim is to provide innovative, integrated, and decentralized services in the post-COVID-19 period, with the benchmark of registering 25 million under 5 children by 2025. How achievable is this, and what is the implication on national planning if not achieved? Well, we're about to find out. Welcome to Nigeria Today. I'm Victor Azu. And joining me to speak on birth and death registration is Dr. Tony Ayejina, Federal Commissioner representing Edo at NPC and Vice Chairman, Committee on Civic and Vital Statistics at the National Population Commission. Thank you for joining us. I've also been joined here in the studio by Sharon Oladiji, a child protection specialist with the UNICEF. It's a pleasure to welcome you as always.
Thank you.
Thank you.
Good evening.
Births and deaths registration. How significant? Let me begin with Dr. Ayejina.
Let me start on a note of gratitude to NTA management and the reporters who have diligently and not conditionally covered the activities of NPC, whether it is the EAD or whether it is civil registration. Your men are at work. That demonstrates the fact that the mandate of the commission derived as established in 1988 and as amended in 1992 is not a one-man job. It's a multitask and multi-institutional engagement. And that is what you have been doing very effectively. Having said so, your question is how vital it is?
Precisely.
Yes, you're asking me for the obvious because in the civilized world, planning is not done in vacuum. It's predicated on statistics. Mm-hmm. You know the people you are planning for. If we are at the level of a household, if a mother wants to cook, it is not simply to go to the kitchen and start preparation for the family. You find out, if you like, you can indulge the members of the family. What do you want to eat? What are you not eating? And then on the basis of that, you prepare your meal for the day. Otherwise, you will just engage on wastages and all of that. Mm. In the same way, a country, whether third world, first world, or whatever you call it, even though I do not accept these categories, we need to plan with relevant statistics and data so that government policies can be measured, whether they are delivery or not.
Now, the statistics we have is for 2018. Where are we now? At least I have the privilege of having you here. Where are we? Let's be able to gauge where we are.
One of the areas of MPC is, apart from censuses, survey, and all of that, MPC is also into vital registration. That covers birth, deaths, marriages, and divorce, if you like. But as we speak, I make bold to say that our emphasis, as at today, is on birth and death registration. And as far as birth is concerned, I think we have recorded about 43% of the coverage is about 43%. For death, it is about 10%.
That means nothing has changed from 2018, because that's what we have for 2018. Will I be right to say so?
No, the process is on. If you say, I don't know at what point in 1980 you got your records, it's a continuous and dynamic process. So if you update your figures, that the picture of 2018 may have changed.
All right. Thank you very much for your opening shots, Dr. Tony Ayejina. Because that also may speak to the fact that we don't digitize or digitalize information, because if what we have in 2018 is what we are still talking about in 2010, it means that perhaps the current or the update hasn't been put out there so that we can access it. But it's fine. Sharon,
yeah.
What is the implication of this? Now we are talking as per 43%, 10%. Where does this leave us from your own perspective?
We shouldn't underrate that figure, 43%. You're talking about 43% of about 32, 33 million children. So we're talking in millions, and the empirical data that we're quoting as 43% is the Demographic Health Survey of Nigeria in 2018. And to make it as evidence-based and as empirical as possible, you don't do data every day. You do data like this. DHA comes up every five years. So we have the one back, then we have the one for 2013, we have the one for 2018, we're expecting the next one in 2023, and you don't guess figures. So this is how we came about the 43%. So as we are right now, until we come up in 2023, we need to give you data and evidence that is verifiable. And that is where we are. But in terms of that 43%, you're talking about millions and millions of children. And children are born daily in Nigeria. So the implication is we need to count, we need to make plans, we need to ensure that this birth on daily, on weekly, on monthly, on yearly basis are registered. And I think that is the base for the Civil Registration and Vital Statistics Day that brought us here.
Okay, thank you very much. I have to get back to Dr. Ayejina again, unfortunately, because if I consider that we are not perhaps where we ought to be in terms of what we have captured, I am trying to tie up. We have birth certificates that are not appropriately captured in the system. You have people who brandish birth certificates, but they don't have it captured. So you probably can't make reference to this. What could be responsible for the gap, Dr. Ayejina?
Yeah, very quickly, is not, I hope you are not talking about the old order of things. As of today, MPC is fast digitalizing its operation, and in all our registration points, about 4,011 or thereabout in the 774 local governments, we are digitalizing, even though we started on a pilot note in all the states of the Federation.
Okay.
The hope is that eventually we'll digitalize and automate the process For the automation, yes, as we speak today, FCT is fully automated, and the plan, we have a roadmap towards full digitalization and automation in the next 5 years or thereabout. Have a roadmap towards 2025 in that regard.
And beyond the roadmap, are there any other efforts being made to address non-compliance at all levels? Because you have to also take into account, it's not a federal thing, you have to also take into account the states and the organs they have to make these things happen.
Whether it's at the federal or subnational or even at the local government, you need all these statistics for planning. Okay. There is no, yes, we have an act which has provided the legal framework for our operations. We rely on education, persuasion, enlightenment to elicit compliance from people. If people understand the relevance of this data, these statistics, you don't need to carry a cane and flog anybody to emphasize the need, the necessity for getting a birth certificate for your child. You need it.
Mr. Oladiji, I want to talk about children. It's your own turf.
Yeah.
When we have, I remember a song which says, now that we found love, what are we going to do with it? When we have all the records, what does it do for the children? Well, the older people, more important than the ones dying, that, you know, they deal with deaths more. But for children, what does it do when we have all of them covered?
Let me start with, we call it the child developmental issues. We call, let me start with survival of children and development of children in terms of education. You just quoted the number of children to be registered in the next 5 years. And sincerely, the way we give births in Nigeria, we will have that 25 million is just 80% of the total number. So in the next 5 years, you just roll out, we just given birth to 25 million children registered. That means we have to plan for them, the food they will eat, the school they will go, the health they will have, the house they will live, the kind of society we want. So when we count, when we support registration of children, it's for the future of the nation, it's for the future of the children, it's for the development of the children. So you have 25 million children, you have to look at teachers, you have to look at the school buildings, you have to look at communities, you have to look at the food that we eat, you have to look at the kind of immunization that we need to give to these children. So for children, it has a lot of, and you see the first 5 years of a child matters a lot. If a child is well developed in the first 5 years, you get a good, and if not, it's the opposite. So for a child, what we do, what we give, how we support, what we provide, what we plan for children has a lot to talk about the future of their children. So right now, we have a bit of, even those children, you want to say in the next 5-10 years they should be in the secondary school, you know. Yes. So you're thinking of education, secondary education, and those who are going to do technical education. So it has a lot of implication if we register the children, for the children, basically to plan the social services for these children. That is why we need to have a record. Before I stop, you look at 20 years ago, 22, 23 years ago, the children born 22, 23 years ago are now serving, they're in youth service. So they roll out of the campuses where the jobs, because at that time we probably did not plan or register them. So it's so easy for children to grow. So we have all these graduates out there and no jobs because when they were born, we didn't plan.
All right, there's really more. You've thrown up a number of issues with your comments, but it's something we'll have to wait to take just after this break. We need to take a breather. Nigeria Today returns shortly. All right, welcome back to Nigeria Today. And if you've just tuned in, we are discussing matters arising from birth and death registration. Now, lack of civil registration and vital statistics system is said to be an African problem. Can it be tackled at the continental level and it becomes effective at the country-to-country level, Dr. Ejina?
Yeah, yes, it can. That is the essence of the African ministers of civil registration who came together in 2017 to pass a resolution to the effect that civil registration is needed in all countries in Africa, and it was adopted at the executive level and has become a policy for the entire continent.
All right. Ms. Sharon,
Yes.
I was going to ask earlier, what percentage, by the way, we talk a lot about of planning, what percentage of all we need to do for our children is planning, by the way? And then, do you toe the same line as Dr. On the last question?
Yes. It has just explained everything to us about planning, even at the household level, even the number, when you go to the market, the number of the mouths you're taking care of and all that. So planning is key. And when you don't plan, you're planning to fail. If you don't plan, you're planning to fail. That is the way I say it. And like he said, the African ministers of civil statistics have been meeting, and sincerely in 2017, because of the low level of the African nations, I'll call it a problem in Africa. There are so many African nations that we don't even know ourselves, we don't count, we don't have an effective civil registration, vital statistics systems, we don't register our children when they are born, the rural communities are not touched, the health and the statistics divisions are not working together across African nations. Not all African nations, I mean, at least the majority. You want to talk about percentage, I'll say 75% of nations in Africa, the statistics, the civil registration and vital statistics report, they're not good.
So would you say that the 25 million benchmark set by the African Union is achievable?
It's not African Union that said, I mean, from the data you reeled out, the 25 million is Nigerian children. 25 million in the next 5 years are from Nigeria.
Okay.
It's from Nigeria. It's because average, we give back to 7.5 million children per year. Per year. There is nothing deterring Nigerians from giving birth to children. We work in the IDPs, in that condition you see babies, in the mountains you see babies, in the river, everywhere you see babies. So the 25 million, it's a number of children that should be registered that are born, in Nigeria. So the issue is the African ministers have come together through the conferences and made the civil registration and vital statistics the 10th August and asked countries across Africa to begin to celebrate it, to begin to put it in the faces of their communities and civil societies and government. And the government should provide leadership to ensure the children are registered and that we have a functional civil registration and vital statistics.
From where we are and what you know, is it achievable?
It is. You see, I'm positive by thinking. I don't see negatives. If we plan to achieve it, yes. Look at us. Even in Nigeria, if we want to do it, we can do it. If we want to do well, we can do well. We don't lack that. The issues is not why we're here. The reason why we don't do it or we don't make it is not why we're here. But when it comes to capacity, and if we put our mind to something, we do. Let me give you the AIDS, even the COVID. women go out, do this. I mean, government go out, do this, we do it. Do this, do it. Wear your mask. So it's not as if we don't have the capacity. Sorry, I'm taking time. Let me take us back to the time of HIV and AIDS. During the time of it, everybody knows there's HIV and AIDS. Everybody knows how to protect. Everybody knows. You see it in billboard. Children knows it. That is what I'm saying. So if we want to change our psyche and want to change our behavior and want to create a change anywhere, we can do it. And I hope we will do this for our children.
Dr. Ejiro, let me ask this. Ms. Oladiji had, the way she sounded from her earlier response is as though we have, you said nothing deters Nigerians from giving birth to children. They just give birth to children, so much of them. Is it workable, or is it something that can be considered to put a peg on the number of children that an individual can have?
I'm not going to talk about Peggy for now, because I think it is not for me to raise new controversies here. But let me respond to whether this policy of 80% registration and automation by 2025 is achievable. I will say yes, and my answer is a big yes, because all that we need to do it is, apart from the major factor that will make this happen, is government determination and funding. And I can tell you from the insider perspective of MPC that yes, in the recent past, no government has supported MPC like the Buhari government has done. For your kind information, we have been given the requisite funds to carry out EAD. We are getting the requisite funding for this digitization and automation program. And my sister, Cheryl, member of one of our development partners, they are giving us very massive support. And all things being equal, I think we are headed towards that direction.
All right.
I don't have power to tell about what tomorrow will be, but I think the EDCs are clear to me.
All right, because we'll be holding you to this when the time comes.
Yes.
But we are rounding off now because I have just seconds to go. Ms. Oladiji, what would be your advice from your own perspective, from the development partner perspective, that needs to be done? If it's not being done already, what can be done differently to ensure that we meet all the benchmarks and do even more?
Let's deal with the apathy in our system. Let's deal with apathy in our households. Let's register our children. Let's talk to one another. Let everybody, let the media help, civil society help, government help. Let's help one another to achieve the results for children.
All right, Sharon Oladiji, Child Protection Specialist with the UNICEF. Thank you very much indeed for your perspectives.
Thank you.
And Dr. Tony Ayejina, Federal Commissioner representing Edo at MPC. He's also Vice Chairman, Committee on Civic and Vital Statistics, National Population Commission. Thanks for your time and expertise on the program.
It's a privilege to be here, sir.
Thank you.
Thank you.
Nigeria Today is live weekdays at 7:30 in the evening. You can also watch this and other editions on www.youtube.com/NTA News 24 Hub. My name is Victor Azu. Many thanks for watching.